Hi guys, Aarvi here from ProPhysio Plus. Today we're going to be talking about meniscus tears and how they occur and whether they can heal on their own. So please like this video, subscribe to our channel and share with your friends. So can a meniscus tear heal on its own? So this will really depend on the type of tear that occurs and the location of the tear. So if your tear is on the outer 1/3 of the meniscus, it may heal on its own or with a small surgery. A longitudinal tear is an example of this kind of tear. Conservative is usually the better choice, and this is because the area has a rich blood supply and blood cells can regenerate meniscus tissue. However, if the tear is in the inner 2/3, which lacks blood flow, the tear most of the time cannot be repaired and may need to be trimmed or removed surgically, like a complex tear or radial tear. So you can see in the images provided where the location of each tear occurs, and that will give you a good indication of what kind of meniscus tear you have and if it will heal.
Okay, so this structure when it's torn will typically manifest with swelling and tenderness around the inner and outer knee joint lines with or without limited or painful knee active range of movement. Considering these structures are injured due to rotational forces, the Thessaly's test will be fitting to reproduce your symptoms, though be mindful that this test can really stir up your pain. This would merit a visit to your local physio for a thorough examination to determine the extent of your injury or if further imaging is required. Following this, a strategy will be implemented to address the contributing factors of your injury, which may address stability or mobility training of the joints above or below to prevent symptom relapse. Other things to look for is your knee giving way, locking when walking, and feeling a lot of instability with your walking pattern. So a common test that we use is the Thessaly's, as I just mentioned. So this is a really easy test for you to administer on your own. All you'll need to do is to plant your injured leg down and ensuring that your toe is facing forward the whole time. So you'll be standing on one leg the whole time, have a slight bend at the knee, and while maintaining that planted foot, you'll just be twisting to one side, slowly twisting to the other side, just really trying to stir up the meniscus to see if there's a tear in there, and a positive sign will be a reproduction of your pain. Okay guys, now it's time for our Q&A segment, which addresses the most common questions for meniscal tears. So the first one is, how does a meniscus tear occur?
Good question. So meniscal tears can be degenerative or traumatic, and it can occur in a number of ways. It can happen on its own or a combination with other ligament injury. Traumatic usually occurs by a twisting movement like Mike discussed in previous videos, occurring when the knee is slightly bent. Whereas a degenerative tears occur as a part of a progressive wear in the whole joint as a result of habitual prolonged squatting in the older adult. The tear may be due to a natural degeneration of the menisci that occurs with age. The medial meniscus is more commonly affected than the lateral meniscus, while tears in both menisci are much less common.
Awesome. Next one is, can this tear heal on its own?
This is discussed further in my previous video, but it really depends on the type, the location, and the size of the tear. Tears in the outer 1/3 of the meniscus, it will probably heal on its own or with a small surgery, whereas the longitudinal tear is the example of this kind of tear. And if the tear is in the inner 2/3, which normally lacks blood flow, the tear most of the time cannot be repaired and may need to be trimmed or removed surgically, like a complex tear or a radial tear.
Awesome. Next question is, how do you check yourself for a meniscus tear?
A torn meniscus would typically manifest with a swelling and tenderness around the inner and outer knee joint line, so it's usually around this kind of region, with or without limited or painful knee active range of movement. You'll also notice the knee is locking or giving way with movement, especially walking, and a Thessaly is a great test that you can do at home, and Mike discusses further in the previous video.
Okay, so the next question is, what can mimic a meniscus tear?
So there can be a number of differential diagnoses for each menisci. For lateral meniscal tears, there's the ITB syndrome, proximal tibiofibular joint instability, snapping bicep femoris, so in the hamstring, and a popliteus tendon. And you can also get like a perineal nerve compression syndrome. So as you can see, there's quite a bit, and that's just from the lateral side. And then we've got the medial side, so that's the inner section. This is usually due to like the medial collateral ligament, the pes anserine bursa, or symptoms due to a patellofemoral joint syndrome.
Jeez, definitely a lot that can go wrong there.
Yeah.
Last question is, can we still walk with a torn meniscus?
Great question. A torn meniscus usually produces well-localized pain in the knee. The pain is often worse when you're doing a twisting or a squatting movement. So unless the torn meniscus has locked the knee, many people can normally walk and stand, sit and sleep without pain.
Awesome. Thanks for that, Aarvi, for answering our quick fire questions. We hope that has served you guys well. Remember to like and subscribe.
All right, so there you have it. We've laid out how you can manage and treat meniscus tears, the causes and what to look for if you have a meniscal tear. So please let us know how you went with it. Please like the video, subscribe to our channel and share with your friends, and we'll talk to you again soon. Remember, making healthy simple.